It's a growing trend. Adults getting treatments traditionally associated with adolescence.
A friend of mine said, "Why are you bothering to do this? You're going to be dead in 20 years. And I said, because the time I have, I really want to enjoy.
Well, and good health, even if only on a subconscious level. One thing that conveys youth and vitality is a person's smile.
I think that's right. In their quest for that, more adults are visiting the orthodontist. Dr. Frank McGeorge is here with the psychology and the technology driving the trend.
Some might just think the idea of adults getting their teeth straightened is about vanity, but it really runs deeper than that. It goes to a person's self-esteem and confidence, both of which often erode as we age.
We see a lot of adults now rebooting their careers at age 50, 55, and going into a different direction, a different field, and it's like, okay, I got to take care of this.
Dr. Scott Tyler is an orthodontist with offices throughout Metro Detroit.
Our adult population is now a full 30% of our practice, which was unheard of 20 years ago. The typical adult orthodontic patient is a relapse case. Back in the day, the instructions to a patient were, all right, you wore your braces for 2 years, why don't you wear your retainer for a couple of years and let's see how that goes. Well, we know how that goes. You go back to the orthodontist.
But many of his patients have never had orthodontia. Their teeth moved as they aged.
Arch form is the #1 thing that we're trying to address in adults because the natural aging process is for the arch to narrow. That's where we see the chipping and the fracturing.
Ruth Foon of Birmingham is one of his patients.
At my age, I want to be comfortable and I want to look good.
So when Ruth was nearly 70, she decided it was time.
I had moved my teeth by grinding them, even in the top, and it just was bothering me. The bite was very bad.
Fortunately, orthodontic technology has made it infinitely easier to correct problems.
We've got a lot of different ways to move your teeth.
Traditional metal and wires can be used in adults, but ceramic brackets that are clear or the color of your teeth are more cosmetic and they've become common. But the #1 choice in adults are
plastic trays, extremely discreet, very comfortable, and the ability to remove the tray for eating and brushing is worth the price of admission.
Invisalign are thin, you just put them on. You don't even hardly know they're there.
Tyler adds, adult patients are different than adolescents, both psychologically.
You wouldn't do this if you weren't motivated, believe me.
And physically, because they've usually had prior dental work. For example,
adults, once you have an implant placed, that's a deal breaker. We're not moving your implant. So we're sort of working to your implant or working around your implant.
Also,
for adults that have a lot of previous restorative experience, they've got a lot of porcelain in their mouth. It's very difficult for us to glue braces to their teeth.
But where there is a will, there is a way.
I think if you're in your 60s and you see that teeth don't look great, do something.
Are you sorry you didn't do it sooner?
Yeah, I really am.
I also want to point out, it's not only about your smile. The position of your teeth also affects the appearance of your lips, jaw, and face, even when your mouth is closed. Having your teeth properly aligned and your bite corrected often produces a more youthful cosmetic change in your whole facial appearance. Back to you.
I had them as an adult. My parents couldn't afford to get them
When
for
you
me
were
when I was a
young?
kid, so I had to wait until I was working. But I can already tell they're shifting. So like you said,
You've got to keep your retainer in, Gil. Doggone it, I know. But it makes sense given, we see people using Botox and brow lifts. Your teeth are a big part of how you look.
Big deal, means a lot.